Have you ever woken up in the morning, blinked a few times, and felt as if your eyes were covered in sandpaper? It's a familiar feeling for many people over 65, yet often we brush it off as just another part of getting older. But the truth is, simply grabbing the first eye drops you see on a pharmacy shelf might be doing you more harm than good. When we treat all eye drops as if they're the same, we risk overlooking changes in our eyes that come with age, and we might miss out on the most effective, protective solutions. The eyes, after all, are one of the most sensitive parts of our bodies, and they can grow more vulnerable over time. Even if you've used the same basic eye drops for years, it's worth asking, are they still the right choice? Or is there a better approach that could protect your vision, reduce discomfort, and help you feel more at ease in your daily life? So many older adults encounter new eye challenges in their 70s and 80s, dryness, increased sensitivity to light, and unexpected side effects from medications. If left unattended, these issues can affect everything from how we enjoy a morning newspaper to how safely we navigate stairs or drive at night. For instance, if you're experiencing cloudy vision because the wrong eye drops are irritating your eyes, you might miss a step in a dimly lit room. That's not just a small inconvenience. It can pose a serious risk to your overall safety and independence. Taking eye health seriously matters because our vision is closely linked to our sense of autonomy, our social connections, and even our mental well-being. When you address eye dryness or redness effectively, you're not just clearing up a bit of irritation, you're preserving the clarity and comfort needed to keep reading your favorite books, recognizing neighbors on your daily walk, and enjoying all the little moments that make life vibrant. If you've ever thought, all eye drops are basically the same, so why bother looking for something specific? You're definitely not alone. Yet countless seniors discover too late that certain ingredients, preservatives, or even the drop's viscosity can make a huge difference in their comfort and safety. Today we'll explore why some of the most common assumptions about eye drops are misguided after 65. First, we'll discuss the unexpected ways age-related dryness affects our eyes and how to choose drops that truly hydrate instead of just masking symptoms. Next, we'll look at medication interactions, because the drops you use can clash with prescription drugs or health conditions in ways you may never have considered. Finally, we'll examine the specialized options available for older adults, those that go beyond your average moisture relief claims and address the deeper changes in aging eyes. By the end of this discussion, you'll have a fresh perspective on eye care, along with practical steps to safeguard your vision, your comfort, and your independence. I've spent years supporting older adults in various health and wellness programs, and I've seen the difference that the right information can make. No medical claims here, just lessons learned from working closely with eye care professionals and seniors who've had both positive and not so positive experiences. You'll discover that something as simple as the correct eye drop choice can lead to better daily comfort, reduced eye strain, and a renewed sense of confidence when it comes to tasks like reading, driving, and socializing. While we share these insights, I invite you to think about your own experiences. Have you noticed changes in your vision or eye comfort over the years? Are there eye drops on your bathroom counter you grabbed just because? Throughout this conversation, feel free to pause mentally and ask yourself how each idea might apply to your life. Together, we'll aim to keep your eyes feeling healthier, more comfortable, and better protected as you move forward. Let's begin by challenging a notion that most people never question. A little dryness is normal. Just use any artificial tears, right? For a lot of folks over 65, that assumption can turn a minor irritation into a chronic problem. Here's why. One of the biggest overlooked aspects of aging eyes is how our tear film changes over time. When you're younger, your tears are balanced with water, oils, and mucus that keep the surface of your eye moist. With age, the glands that produce these components can slow down or become inflamed, leading to incomplete tear production. That's why you might wake up with scratchy eyes or find them feeling irritated in the afternoon, even when you're not particularly tired or stressed. It's not all in your head. Your eyes truly are drier. William, age 70, first noticed this when he retired and began spending more time reading. After an hour or two with his new hardcover novel, he'd feel a burning sensation. His solution was to pick up the same brand of eye drops he remembered using in his 50s. But these drops, while popular, contain preservatives that can actually aggravate dryness when used frequently. William would apply them every few hours, get temporary relief, then end up even more uncomfortable by the end of the day. It was a frustrating cycle that he chalked up to aging, never realizing that the drops he selected might be contributing to the problem. So what changed for William? A visit to an optometrist revealed that he had a form of chronic dry eye that worsens as we get older. The first step was cutting back on preservative-heavy drops and switching to single-dose vials or drops specifically labeled preservative-free. The difference was night and day. William found that after using the more suitable drops, he didn't have to keep reapplying them so often. His eyes felt consistently less irritated, which made his favorite hobby enjoyable again. He even reported fewer headaches since he wasn't constantly squinting against burning, watery eyes. Perhaps you've had a similar experience. A quick trip to the pharmacy, scanning the shelf and thinking, dry eye is dry eye, right? Let me just grab whatever's on sale. Unfortunately, that assumption might be costing you comfort and clarity. While some drops are fine for occasional dryness, many brands use additives to increase shelf life or create a certain texture. For older eyes that produce fewer or less balanced tears, these additives can do more harm than good over the long haul. Some drops are oil-based, specifically designed to replace missing tear components. Others are watery, which may work for mild dryness, but fail to address more serious cases. There's even a difference in how they coat the cornea, which is crucial for both lubrication and healing any minor scratches or irritations. The best approach is to look for eye drops that directly match your dryness level and frequency of use. If you find yourself needing them more than 4 times a day, it's a strong sign that a preservative-free option would be kinder to your eyes. Even better, ask your eye doctor for a quick tear evaluation. It might sound fancy, but it can be as simple as them placing a tiny piece of paper under your lower eyelid to measure your tear production rate. Knowing whether you have an evaporative type of dryness versus an aqueous deficiency can guide you to the right solution. This not only saves you money on trial and error buys, but also helps maintain healthier eyes in the long run. Think of it like choosing a pair of shoes. If your feet have changed shape, you don't keep wearing the same size and style you wore decades ago. You adjust. The same principle goes for selecting eye drops. One size definitely does not fit all. When you prioritize your unique dryness profile, you're acting with both safety and comfort in mind, preventing potential eye surface damage that could lead to blurred vision or infection. As you contemplate your next steps, consider whether you've paid attention to the kind of eye drops you're using or how often you use them. A small switch may lead to significant relief. If you have a quick moment, think about whether you've ever experienced that rebound effect where relief only lasts a short while before your eyes feel just as bad, or worse. That's often your body signaling that the drops are not well suited to your current needs. Before we move on, take a moment to reflect. If you could find a type of eye drop that immediately feels soothing and actually lasts, how would that change your day-to-day comfort? If it sparks your curiosity, you're on the right track, and there's more to uncover about what's really happening when we use a one-drop-fits-all approach. Next, let's delve into a common blind spot in eye care: how interactions between eye drops and other medications or health conditions can shape your overall well-being. It's easy to think of eye drops as something isolated. After all, you're just putting a few drops onto the surface of your eyes. But for those over 65, eye drops can interact with other medications or underlying conditions in ways that are frequently overlooked. Many seniors manage a range of prescriptions for conditions such as high blood pressure, arthritis, or even minor aches and pains. Although it might sound surprising, certain eye drop formulas can exacerbate or at least complicate existing health issues. Mary, 75, discovered this the hard way when her routine eye checkup showed a slight increase in intraocular pressure. Her doctor asked about her eye drop usage because certain drops, particularly those meant to reduce redness, can temporarily constrict blood vessels in the eye. For someone with normal eye pressure, that might not be a huge deal, but Mary had a family history of glaucoma, and her doctor worried that these redness relief drops could mask symptoms or even contribute to further issues down the line. In addition, Mary was managing her blood pressure with a prescription medication. The eye drops she had chosen contained ingredients that raised her blood pressure slightly, counteracting the benefits of her daily pill. She had been relying on these drops for years, blissfully unaware of their potential side effects. When we're younger, our bodies are more resilient to minor fluctuations caused by over-the-counter treatments. But after 65, minor fluctuations can have major consequences. That's not to say that everyone must abandon all over-the-counter redness-reducing drops. Some people use them occasionally without problems. The key is awareness. Reading labels closely is a start, but many of us need more than a quick glance at tiny print. If you have pre-existing conditions, glaucoma, hypertension, diabetes, or other issues that affect your circulatory or nervous systems, asking your eye doctor or pharmacist about specific drop ingredients can be a game changer. Sometimes even drops labeled natural or herbal have compounds that produce unexpected side effects. Of course, side effects don't always show up as a big dramatic symptom. They can be subtle, a mild headache that's more frequent than usual, a slight but persistent blur in your peripheral vision, or even increased light sensitivity. When we assume that all eye drops are harmless, we might brush off these signs and chalk them up to general aging. In reality, these signals might be pointing to an ingredient in the drops that doesn't mix well with your body's current chemistry. Another aspect to consider is the preservative known as benzalkonium chloride, BAK. It's commonly used in eye drops to prevent contamination, but it can also irritate the surface of the eye over time. For seniors who are already dealing with decreased tear production, repeated exposure to BAK can cause corneal damage or worsen dryness. This is particularly concerning if you're using multiple eye drops a day for different reasons, perhaps one for allergies, another for dryness, and another for redness. The cumulative effect of these preservatives can be more detrimental than we realize. Medication management becomes more complex as we age, especially if multiple specialists are involved. You might see a cardiologist for your heart, a primary care physician for general checkups, and an ophthalmologist for your eyes. Each may provide suggestions or prescriptions without fully knowing what the others have advised. That's why it's so important to keep an updated list of all medications, including over-the-counter eye drops. When you inform your healthcare team about every product you use, they can help identify potential conflicts before they become an issue. Protecting your eyes goes hand in hand with safeguarding your overall well-being, particularly if you're dealing with chronic conditions. Think of it this way. Your eyes are connected to your entire body through blood vessels, nerves, and lymphatic channels. Anything that impacts those systems could affect your eyes and vice versa. Rather than seeing eye drops as an isolated quick fix, consider them part of a holistic approach to your health. It might mean swapping a certain drop for one that's more compatible with your blood pressure medication, or skipping a redness reliever in favor of something that supports eye hydration. If you're wondering whether your current eye drops might be interacting with your other medications, this is a perfect time to reach out for professional guidance. Make a short list of everything you're using: prescription meds, over-the-counter pain relievers, supplements, and eye drops, and bring it to your next appointment. Ask, is there anything here that could be conflicting? You'd be surprised at how often small adjustments, like switching to a drop with a different active ingredient or using a preservative-free formula, can improve not just eye comfort, but also overall health markers. Before we look more closely at specialized eye drop options tailored for seniors, consider the last time you checked your eye drop label for anything more than a brand name. It's an easy detail to dismiss. Taking a closer look could be the difference between a minor inconvenience and a long-term complication you didn't see coming. Are you willing to take that risk, or do you prefer peace of mind, knowing that the choices you make align with your unique health profile? If this is sparking any questions in your mind, take a moment to reflect or even jot them down. You might be wondering if your own symptoms, maybe that pesky redness at night or that tired sensation after a few hours of TV, could be affected by the drops you use. It's always a good idea to talk with a healthcare provider to get clarity on how these little bottles of liquid might be influencing big-picture health. After all, every drop counts when it comes to preserving your vision and well-being. Now let's turn our attention to a topic that gets surprisingly little coverage: the specialized eye drops specifically designed to address age-related issues, from advanced dryness to glaucoma. We often think of eye drops in just two categories, moisturizing and redness relief. But the truth is that medical research has evolved rapidly. Many new formulas target the unique ocular changes older adults face, and they go beyond what a standard, all-purpose drop can do. Harold, 80, had been using the same eye drops for over a decade to combat mild dryness. As time passed, he started experiencing not just dryness, but also occasional blurred vision, especially after reading for a long time. He assumed it was just normal aging until his optometrist explained that some eye conditions, like meibomian gland dysfunction, become more common later in life. In this condition, the glands that produce the oily layer of tears become blocked or inefficient, leading to tears that evaporate too quickly. Traditional watery drops didn't address his deficiency of oils. He needed a lipid-based eye drop that would specifically bolster the protective oily layer of his tear film. Once Harold switched, he immediately noticed a difference. His eyes stayed comfortable far longer, and he experienced less fluctuation in his vision, especially late in the evening. This small shift allowed him to continue reading, one of his greatest joys, without constantly rubbing his eyes or blinking to clear the blur. Best of all, he felt safer driving at night to see family and friends because his vision remained clearer. For others, specialized drops might include antioxidant formulations or prescription-strength lubricants that contain active ingredients to not only soothe but also help heal minor damage on the cornea. Some drops are designed to balance pH levels in the eye, creating an environment that promotes healthy tissue and fights off bacteria. There are even prescription drops that address inflammation, which can be a driving force behind chronic dryness in older adults. Another category worth mentioning is prescription eye drops for conditions like glaucoma. Although these are not over-the-counter, they demonstrate how important it is to recognize that different formulas serve different purposes. Glaucoma drops often work by lowering intraocular pressure, which can prevent further damage to the optic nerve. This isn't something that a typical tear replacement drop can do. If you or someone you know has borderline eye pressure or a family history of glaucoma, it's worth having a conversation with an eye care professional about whether there are specialized drops that might help prevent progression. Yet for many seniors, there's a belief that going beyond the standard OTC solutions is too complicated or expensive. While it's true that some specialized drops can cost more, the benefits often justify the price, especially if they offer genuine relief or slow the progression of a vision-threatening issue. Additionally, some insurance plans or community health programs may cover all or part of the expense if a drop is medically necessary. It's an avenue worth exploring rather than automatically assuming it's out of reach. Emotionally, investing in the right kind of eye care provides a profound sense of safety and control. The eyes can feel like a direct link to the outside world. When your vision is clear and comfortable, everything else, from social engagements to basic daily tasks, seems more manageable. Knowing that you're using a product specifically designed for your age group or health status can instill confidence that you're protecting one of your most cherished senses. Curious about where to start? The first step is discussing your specific symptoms with an optometrist or ophthalmologist, especially if you've noticed persistent dryness, blurriness, or discomfort that doesn't resolve with standard drops. They might perform simple tests, like the tear breakup time or a quick gland function assessment, to see exactly where the problem lies. With that information, they can recommend a specialized drop that targets your unique challenge. These might include drops containing lipids, electrolytes, or other ingredients tailored to an aging tear film. If you're not quite ready for a visit to a specialist, doing a bit of research on your own can help guide you. Look for terms like lipid-based, non-blurring gel formula, or extended relief on the label. Keep in mind that not every formula labeled long-lasting will be right for you, so read up on what makes it long-lasting. Is it thicker? Does it have an oil component? Some seniors find relief in gel drops, especially at night, because they form a protective layer that helps keep the eye lubricated while sleeping. Others may prefer a milder, water-based drop during the day. And remember, this journey does not have to be done in isolation. Many pharmacies have consultation services, and a quick conversation with a pharmacist can clarify which specialized drops might be suitable. If you have family or friends who also struggle with dry eyes or age-related eye conditions, compare notes. Sometimes the best tips come from shared experiences. By exploring these specialized solutions, you put your comfort and safety first. You also broaden your options for staying active, reading your favorite magazines, or even just enjoying a sunny afternoon without constantly seeking shade to relieve irritated eyes. It might seem like a small step, but these minor changes can add up to a significant boost in quality of life. Before we wrap up, take a moment to envision how different your daily routine could feel if your eyes were consistently comfortable. It might mean fewer breaks to rest your eyes, more confident trips out of the house, or just the peace of mind that comes from knowing you're doing everything possible to protect your vision. Specialized care may sound high level, but it often starts with nothing more than an honest conversation and a willingness to try something new. If you're still with me, you've likely realized that treating all eye drops as equal can be misleading, especially after 65. What feels like a small oversight, grabbing the first product on the shelf, can accumulate into chronic dryness, potential medication interactions, and missed opportunities to relieve discomfort or slow down eye issues that become more common later in life. We've covered three main areas: understanding how age-related dryness alters the tear film, recognizing the importance of medication interactions, and exploring specialized eye drops that go beyond the one-size-fits-all approach. At this point, you might be thinking about rummaging through your bathroom cabinet to see which drops you actually have, and that's a great start. Being informed is the first step to making a real difference in your eye health. The key takeaway is that your eyes require individualized care, just like any other aspect of health. They're a precious resource that keeps you connected to the world around you, so investing a bit of time and thought in proper eye care can pay dividends in daily comfort and long-term safety. There's also an element of urgency here. Eye problems often creep up slowly, and once certain damage is done, like issues stemming from uncontrolled dryness or unmonitored pressure, it can be much harder to reverse. By acting sooner rather than later, you're giving yourself the best chance at preserving healthy, comfortable vision. Envision yourself a few months from now, no longer squinting against dryness, no lingering fear about whether your eye drops might conflict with your blood pressure medication, and no second guessing about whether there's a better option out there. Instead, picture the simple joy of reading a menu clearly when dining out, feeling confident while driving at dusk, or chatting with friends without constantly blinking to ease discomfort. These are the little freedoms that add up to a life well lived. If you're ready to take the next step, here are some ways to move forward. At the simplest level, begin by checking the ingredients on your current eye drops. If you see preservatives like benzalkonium chloride, and you use those drops multiple times a day, consider switching to a preservative-free alternative. For those of you juggling multiple health conditions or meds, make an appointment with your pharmacist or doctor to discuss potential interactions. Mention your eye drops in that conversation. Sometimes these details slip through the cracks, but can make a big difference. Feeling even more proactive? Schedule a dedicated eye exam specifically to assess dryness, glaucoma risk, or any other concerns. Share with your optometrist or ophthalmologist the exact drops you use and how frequently. Ask them about specialized formulas if your dryness is severe, or if you suspect there may be underlying conditions like blepharitis or meibomian gland dysfunction. This is where you can get targeted advice that matches your personal health profile. If cost or insurance coverage is a concern, inquire about generics or assistance programs. You'd be amazed at the resources out there when you know what to look for. Finally, share your experiences. Whether you're part of a senior community center, an online forum, or simply have friends in your age group who also deal with these challenges, your journey might inspire someone else to ask the right questions about their eye health. This sense of shared discovery not only fosters a community of support, but also helps others avoid common pitfalls and misconceptions. Always remember that these decisions remain in your hands. Aging doesn't have to mean surrendering your comfort or settling for less than ideal solutions. You've accumulated wisdom throughout your life, and now you can use that wisdom to make informed choices about something as important as your eyesight. With the right knowledge and a willingness to take action, you can protect your eyes, enhance daily comfort, and continue enjoying the activities you love. Thank you for spending this time to learn more about your eye health. If you found this conversation valuable, consider sharing it with someone else who might benefit. And if you have any lingering questions, don't hesitate to speak with a healthcare provider or do a bit more research on your own. Your eyes are worth every ounce of care you can give them. Above all, trust that small changes today can lead to a clearer, more secure tomorrow. Because it's not just about seeing, it's about living fully and confidently at every age.